Welcome. This is a really exciting opportunity for members of the Wellness Center team who are serving as our community health outreach team and our care coordination team, particularly those that are working with clients and patients to overcome their vaccine hesitancy through answering their questions, building trust and rapport. So I'm Heather Hayes. I'm the Associate Director of the Wellness Center and the LAC-USC Medical Center Foundation, and we are delighted to be with our colleagues from the LAC-USC Medical Center who are going to help answer those questions that you have yourself or that you hear from the community so that we can better engage the public and really encourage as many people as possible to get vaccinated. So with that, I'd love to introduce Dr. Manuel Campa and Dr. Faye Kristen, PhD, who have joined us today to talk a little bit about how we can have those one-on-one conversations, be honest with community, and really give them the best advice and information possible. So with that, I will turn it over to Dr. Campa. And if you want to do a little introduction for those that may not know you, that would be lovely.
Sure. Thank you so much, Heather. And thank you all for joining us so early in the morning. I know 8 o'clock meetings are rough for some of us, but thank you all for joining, and we're really happy to be here. I'm Manuel Campa. I am the primary care director and a primary care physician here at LAC-USC. I see some familiar faces, so I'm really happy to be working with you all again and sharing some information with you today. I'll go ahead and let Faye introduce herself.
Hi, my name is Faye Christian, and I know some of you as well. And thank you for being here. I'm the primary care nursing director, and I've had the privilege to work with the Wellness Center for quite some time now. So looking forward to working with each and every one of you.
Great, thank you. So today's talk is titled COVID-19 Vaccine Champions Training. That's what we're trying to do. We're trying to make you all champions for the COVID vaccine. The subtitle is Improving Vaccine Confidence Among Patients and Staff. So we are going to be sharing some information about the vaccine, some basic science, the development of the vaccine, as well as tools for you to be able to engage in meaningful conversations with patients and community. I just want to note that these slides and this training is adapted from a larger DHS group, so the Department of Health Services at LA County. Dr. Trin, Charmaine Dorsey, Dr. Lopez, Dr. Abad, and Dr. Campa are all really amazing physicians in the county who put this training together. So we've adapted some of it so it could fit within the hour and still allow us some time to answer some questions and maybe do a bit of practice. So just some ground rules I'd like to set. So if you can, just so that we know who you are, type your name and roll into the chat box. I know there's a lot of people on, so I know we won't be able to go around and do everybody's introduction, but it's always nice to see who's joining us for the talk. And then my other 2 rules are just, any questions that you have, that's why we're here today, type them into the chat box. Even if you've heard it from somebody, if it's come to your mind or you've heard it on the media, type it in. Let's try to see if we can get to it today. And there are no silly questions. Everybody has their perceptions and their view of the vaccine. And so we want to make sure that we address all those in a way that that can truthfully answer, what might be the truth behind that. Okay. So as I mentioned, we're divided into about 3 parts today. Part 1, we're going to review the current trends in the COVID-19 infection epidemic, as well as vaccine data. We're going to describe some of the vaccine development and the concepts around immunity. How do we get protected from the vaccine? And then we're going to review some common myths and facts around the vaccine. Then we're going to switch gears, and then we're going to start to describe why some patients haven't been vaccinated, and then understand the concepts and techniques that we could use to really be effective around patient engagement to motivate them to get the vaccine. And then we'll talk about some motivational interviewing, which I think some of you all have maybe done. So it'll be hopefully a refresher for most, but for the rest, it'll be a chance to learn something new. And then hopefully at the end, some time to answer questions and or practice with each other kind of in this group and see if we could have some of those conversations with each other and just get used to the mechanics of having these conversations. All right. So with that, we're going to get started with part 1 and start reviewing COVID. So to give everybody an update, as of yesterday in Los Angeles County alone, there were over 1,200,000 cases confirmed in Los Angeles County. The 7-day average has now bumped from the low hundreds into the 2000s. And that 14-day change over the past 2 weeks has been at the level of 145%. That's mean we've almost 1.5 doubled the rate over the past 2 weeks of people getting infected. The other thing that's concerning, right, and what we see usually with the lag is deaths. And so we're almost going to eclipse 25,000 deaths. And the 14-day change rate has also been 20%. So we're increasing at a steeper rate. And what we know, the reason behind all this is that we only have about 61% of our community vaccinated who are eligible. So that's really a challenge because we haven't reached that level of immunity where we protect each other by all of us having the vaccine. So talking about the vaccine, overall, we've actually done an incredible job in Los Angeles County, given the state that we were in the winter. So there's almost been 11 million vaccine doses administered to almost 6 million community members in Los Angeles County. So of our 16-year-olds in the community, at least 70% of them are vaccinated. And for our seniors, we did an incredible job. Almost 90% of our seniors have received at least one dose. So for certain groups, we know we've done a great job, but we'll talk in a few minutes about other groups and what areas of focus we might want to be looking at as we do this kind of next phase of vaccine outreach. Okay. So where does COVID compare to flu? I know we always hear this, and we've heard it from the media, we've heard it from the president before President Trump. It's just the flu. And really it's not, and this data is actually a little bit dated because the US has already eclipsed over 500,000 deaths. And this is looking at mortality. So how many people die per year. And so even looking at a horrible flu year, like an H1N1 year in 2017, the comparison is still really staggering. There's way more deaths from COVID than there has been from flu. Even when you combine several years in a row. So COVID is definitely something that we need to pay attention to and really put a lot of effort in because of the risk that it puts to our community.
Hey, Dr. Kampa, just really quickly, I want to make just a quick announcement. If people have a question, you can always type your question into the chat so we don't lose it, or you can raise your hand. You raise your hand on Zoom by going to under the button that says participants. You can go ahead and raise your hand. I think that's how it works.
Actually click on the reactions and there's an option for raise hand.
Thank you, Magali. Thank you. It doesn't look that way anymore. Yes. So under the button called reactions, if you click on that and raise your hand, then we'll know to call upon you. I know this is such rich information and Dr. Kampa, it's so exciting, but I want to make sure we don't lose questions along the way.
Definitely. Sounds good. Please do so. Please do so. We're happy to answer them. This slide, again, is important. And again, really informs the work that we're trying to do. This tells you how many times more likely are you to die compared to white Americans. And so we see here that Black patients are 2 times more likely, Latino or Latinx 2.4 times more likely, Pacific Islanders 2.6, and Indigenous Native folk 3.3 times more likely. So, when we see disparities, and something the Wellness Center has really put a lot of effort in for chronic disease management and things like that. The COVID is in particular, following that same trend where our communities of color are experiencing a disproportionate number of deaths. And we know part of this is because of the vaccine, right? We're not seeing some of these communities uptaking the vaccine as much as we would want them to. And so this is from data from the California Department of Public Health, so for the state, from early July. And then again, it shows that our Black and Latinx communities have not reached thresholds that the white and Asian communities have reached in terms of being partially or fully vaccinated. So again, we know that's a core reason why the pandemic has continued to propagate in Los Angeles. So this I'll try to simplify this as best I can, but one thing that's important to know is how do we build immunity? And this means how do we build protection within our bodies to help us fight infections. So what happens in the basic science level, once the virus gets into your body, it enters into some of your cells. And these cells are the cells that become infected and what you start to see your symptoms, right? So they get infected into the lungs, they get infected into your nose and throat. And when that happens, the virus starts to reproduce itself inside your body. And it's not until a cell from your body's immune system, the system that protects your body, that it starts to detect the virus or virus particles, does it then start to produce antibodies. So antibodies are proteins in the body that actually start to gather around the virus and gather around the infected cells, and it brings in all the rest of your body's immune system and fighting cells to start killing the virus and killing those cells that are infected with the virus. So all of that takes time, right? Which is why we see the infection cause symptoms for a few weeks, then you get better, and then your body is protected. And so if you do get infected naturally, through exposure to the virus, you will have some level of immunity for some time because your body has produced now a response against the virus. But this is going to be important to know that this doesn't last as long as we think it does. And so the science is telling us that this is limited to a few months. And so that's why it's so important for us to get the vaccine, because the vaccine works in a different way in order for us to produce protection. So how that works, so what the vaccine does, in particular the Pfizer and Moderna, which are called mRNA vaccines, what they do is they package a little bit of the virus's genetic material around a big glob of fat. And fat is important for your cells because when two cells meet together with fat, they'll merge. And so the reason why this vaccine is so effective is that it merges into your immune cells, and it actually tells your immune cells to produce a small protein of the COVID vaccine the COVID virus. So we're not necessarily injecting the patients with viral particles like we do with flu vaccines and tetanus and measles, right? Vaccines that are kind of older technology. This is a new way to do so, where we're actually using your body's own mechanisms to produce proteins so that your body can have a robust and really strong immune response. And so that's why we've seen the protection from these vaccines being so high, close to 90%, compared to some of the other vaccines that we use, where we typically don't see that level of protection. Okay.
Dr. Kampa, before we leave that section on mRNA, can you talk a little bit about how this technology has been in development for a very long time, and though it's being used kind of freshly now, it really is a tested technology in the sense that it's been in development a very long time? Yeah,
I think there's a slide on that. So we'll
get there.
If it's not there, if I took it out, then I'll cover it right now.
Preview things to come.
So there's 3 vaccines, right, that are approved for emergency use right now in the United States. It's Pfizer, which is a 2-dose vaccine, Moderna, also a 2-dose vaccine, and Johnson & Johnson, which is 1 dose. All of these have had really, really big studies that the FDA has looked at, and they've given that emergency authorization. They do also give formal authorization after more information is produced, but it's the same body that gives these approvals. They gave this emergency use because they saw how strong the data was at protecting patients against COVID. And this is what they looked at. This is kind of basic data, where this blue line tells the scientists, people who didn't get the vaccine, who got a placebo, who got just a injection of some saline into their arm, how many of them got the infection? And you saw that the rise was really, really steep. And for those that got the vaccine, this orange line, it stayed really, really low. So that told the scientists early on, within a matter of days, this is out to about 120 days. So within 3 months, they knew that the COVID vaccine was already going to be really effective early on. Okay, let me make sure that I cover that question though. So just to go back to Heather's question about the vaccine development. So the COVID vaccines were actually already being designed because the world has seen COVID before. There was an infection called SARS. They went as kind of a local epidemic in Asia in the year 2003. And then there was MERS in the early 2010s, which was in the Middle East. Those were all COVID viruses. And so scientists had already been working around the world on figuring out how do we protect people if these viruses ever propagate and become a huge epidemic. And unfortunately, they were, challenged with that task as COVID-19 exploded onto the world. So these vaccines were already, being studied. They were already being tested. And so when COVID came, it was really simple because they're only looking at genetic material. As soon as they found out that genetic material, which they can usually identify within a matter of days, they started working on the vaccine. And so I know, again, with the traditional vaccines where we're using viral particles, those take a lot more time because they have to figure out what's the right mix of particles that they need to put into the vaccine. With the mRNA vaccines like Pfizer and Moderna, it was really easy because all they had to do was find the genetic material, put it into that ball of fat, and then start testing it on patients. And that's really what has saved so many lives up to this point, was that really rapid development of the vaccine.
Dr. Kampa, there's a question. There's a couple questions in the chat, and I want people to know that I will bring your questions in where I think it's appropriate, but there's one about a recommendation of one vaccine over the other.
So I get that question a lot as a provider in the clinic. And my response is that the best vaccine is whichever one the patient is comfortable getting, because at the end of the day, they're all going to provide protection from the things that we worry about the most, which are hospitalizations, ICU admissions into the intensive care unit, and death. And so far what we've seen is that there's only in across LA County, people who have been vaccinated, the chance that you're going to even die from COVID after you've been vaccinated is 0.004%, which tells you that there's only been a handful of people. And even then, we don't even know if those people died from symptomatic COVID. They just tested positive when they were in the hospital. They could have been admitted for so many other things. So all the vaccines are effective, as I had shown right here. They all have kind of varying degrees, and it's changing as we learn more about them, about how much protection from COVID you're going to have if you're exposed and if you're going to actually get, mild symptoms. But all of them give excellent and almost 100% protection against hospitalizations, ICU, and death. And so that's the reason why we're telling patients to get the vaccine. Okay, so just to touch quickly on herd immunity, because this word gets tossed around a lot. I know if you listen to Dr. Fauci on his talks, or you've heard on the radio, they talk about herd immunity. And what that means is, a herd is, if you think of an animals, right, they gather into herds. And so that's the same thing with humans. We are a community of people who live amongst each other. And so when there's only a few of us vaccinated, it's really easy for one person to start infecting everybody else who's not vaccinated. And so that's what that picture on the left-hand side shows. Now, when a lot of us are vaccinated, when we get to a certain threshold of a big portion of the community vaccinated, that person who's not vaccinated and infected has less and less chance to spread that disease farther and farther into the community. So that's why herd immunity provides protection for those who can't receive the vaccine. We have children who can't get vaccinated yet. We have elderly patients who maybe have reactions. We have or are confined to certain spaces and can't get the vaccine. We have people who actually have real allergies to the vaccine and can't get it. And so that's the reason why all those who are eligible, we should try as much as we can to educate and support so that they get the vaccine. Okay, so there's a question of how much longer does it take for us to get there? Because I know all of us are tired of wearing masks. We're tired of social distancing. We want to be with friends. We want to go back to concerts, Dodger games, but it's still a ways away. Where we're seeing ourselves in the next few months is that the scientists are predicting if we don't really accelerate the rate of vaccines, we're not going to see the herd immunity happen until the next year or so. And if we had no vaccine, we wouldn't see it until 2025. And that's because the virus would have ran through the entire community. And so when we get to 80% vaccinated, we're going to be closer to actually achieving herd immunity in 2021. But when we're still sitting in that percentage that's below 80 and in between 50, we're probably not going to see herd immunity until later next year, possibly the year after. And that's really because people are going to get that natural immunity from getting the infection. And we don't want that, because that puts them at risk for actually having those bad outcomes. Okay, so these are just some considerations about when we're giving the vaccine. Right now, we just want people to get it. If you do have allergies, we are observing patients. Other vaccines don't need to wait. Before we were kind of pausing flu shots and pneumonia shots and whatnot. All those can be given together. And even patients who have reduced immune systems from chemotherapies or from chronic diseases that don't allow them to have big immune responses that we might predict, we're still saying, give them the vaccine. Let's get them protected as much as we can. The same thing with pregnancy and breastfeeding. It's super important because moms are now going to have vulnerable babies who are not going to be protected because the vaccine can't be given to them. And so I've experienced this personally. My wife just delivered a baby. We have a 2-month-old, and thankfully she got vaccinated. So now that we know, her bloodstream and her protection gave the baby some antibodies. Her breastfeeding now is giving him additional antibodies so that he can be protected from COVID if he is exposed. And that's really why we're trying to advocate for moms and women who are thinking about becoming pregnant to get the vaccine as well. Okay. And the other group that we're worried about, right, is kids. We know our 16-year-olds and our 12-year-olds can get the vaccine, Pfizer. We're really, really hopeful that in the next couple of months, we can see our 5 to 12-year-olds, and then hopefully soon after, with EUA approval, see our young children, 6 months to 5 years old, finally get their vaccine. So we're crossing our fingers that the data shows, low side effects and low risk and good protection for our kids, so that they could get the vaccine as they transition back into in-person learning. Okay, so I'm going to switch it over to Faye now, who's going to talk about some of the vaccine side effects.
Hi, everybody. Can you hear me? Mm-hmm. Okay. So I think, for many of you who are already received the vaccine, you may have already experienced these. So some of the COVID-19 vaccine side effects include tiredness, pain or swelling at injection site, fever, chills, and headache. And as you all know, depending on what vaccine you get, for some of the vaccines like Pfizer, some of these symptoms are more likely to happen on the second dose versus the first dose. But it's a redness or tenderness where you got the shot in the first 24 hours, and you call a provider. If your side effects are worrying, do not seem to be going away after a few days, these are some of the areas that you would contact your provider for. But otherwise, all symptoms are expected to resolve within 48 hours. Okay, next slide. This was a breaking news. U.S. calls for pause on Johnson & Johnson vaccine after blood clot cases. So there were 8 million people vaccinated with Johnson & Johnson, and 6 cases of rare blood clots occurred. So this was big just because of the 6 cases it was an unknown effect of the vaccine. And these were for ages 18 to 48 years old, 2 weeks after being vaccinated. So some of the symptoms were severe and unusual headache, shortness of breath, stroke-like symptoms, and abdominal pain. So there's a 0.00075% chance of getting it versus a 20% chance of getting clots from COVID-19. And as evidenced by it coming back into the market, it was shown that it was not a big risk. And now some of the considerations that we just take is assessing individuals for those who are more likely to develop clots. And in these cases, we offer the Pfizer or the Mrna vaccine if those are available in the facility. Next slide. So allergic reactions. These are not very common. Okay, so the chances of having an allergic reactions is 11 out of 1 million vaccinated have allergic reactions. And this may occur within the first 15 minutes, and all have recovered with treatment. And I will just tell you from LAC, USC, where we've given over 45,000 doses, we've maybe had only 1 or 2 real allergic reactions where we had to go to the ER. A lot of them are really more related to anxiety, or just people kind of like have it in their mentation that they're going to develop reactions and then feel it afterwards, but they've all really resolved. So it's really not very common. And we usually see it after the first shot. And at that point, if that does happen, then we definitely don't give a second shot if the second dose is applicable for that vaccine. Next slide. So breaking news, people who are completely vaccinated don't need to use face masks when outside. So this was breaking news a while back, by the way, and you all should already really know this. Can visit without a mask with other people who are vaccinated, can visit without a mask other people who are not vaccinated, including children from one home who have low risk of getting seriously ill from COVID. And people who are not vaccinated are required to use a face mask at all times. And some places may still require face masks regardless of vaccination status, workplaces, business, public transportation. And as very recently, everyone indoors, because of the rise in COVID-19 cases, have been asked to wear masks again. And in the healthcare arena, and especially here in LAC and DHS, we've never really lifted the mask policy. So as you all know, we require that everybody wears at least surgical mask at all times and try to practice social distancing. Next slide. Okay, so we're going to get into the myths and truths. This is one of the most common myths that I'm sure all of you may have heard, is the COVID-19 vaccine has a microchip in it and was made to control and track people. So overall, I'm going to tell you kind of the background, but overall, the vaccine does not contain a microchip, nor does it track people or gather personal information. So in this photo, you see Bill Gates and his former wife, Melinda, and they have been, they're known to donate money for creating medications like vaccines, and have partnered with MIT for research. So we believe that the source of this myth came from, in other countries like Africa, they don't really have a tracking system like we do, like an electronic health record, like ORCID. So what they looked into was an invisible die to keep track of those who've been vaccinated. Down the line, someone could either shine a light or use a smartphone app to see if the ink is in your skin. So it's like a tattoo. This idea never got past animal testing, so never really happened. But if you, Manuel, can you hit next so that they can see the syringe? I think it's up. Yeah, thank you. So the combination of that kind of idea and the syringe that we use for COVID vaccination, which is called a vantage point, where there's a retractable needle, and if you can see, there's that kind of like gray area, and then the once you've administered a vaccine, the needle disappears. That idea of like the needle disappearing caused people to think that a microchip was then inserted, but that's really just for safety. So those two like ideologies put together or thoughts then form the idea that there is a microchip and it's controlling and tracking people. So that myth is not true. Next slide, please. Okay, this was also a strong myth, especially at the beginning when the EUA was just approved. So the myth is we can't trust COVID-19 vaccines because they were rushed. The truth is no steps were skipped. The difference is the phases were overlapped, and we'll talk more about it right with these photos in front of you. And the production started during the phases. So the first kind of timeline is a traditional development. So you see the first phase of animal testing, and then you see the first kind of like overall group, and then you see the phase 1, phase 2, and phase 3 of human testing. So the phase 1 is really assessing whether it's safe for people, right? And then for phase 2, is it efficacious? So whatever we're testing, does it work? So for this case, the COVID vaccine, does it work against fighting COVID? And then phase 3 is really to study certain groups of people, pregnant people, children, so different groups. And so asking if it's safe for these groups and is it, and how long does immunity last? And then the next pieces are the regulatory review by FDA and then large scale production. So if you look at now the timeline for the COVID-19 vaccine, you see that animal testing, there was no overlap, fully done with animals, right? And then we go to the clinical trials, now you see the overlap. You see phase 1, where it was deemed after many administrations that it was safe for people. So they just overlap phase 2 while continuing phase 1, finding out if it's efficacious. And if you saw Dr. Kampa's slide earlier about that slide where placebo versus the administration of vaccine, we saw that the answer was yes, it is efficacious for people. And then phase 3, so the EUA, the production then started when the EUA came, and as you know, phase 3 was still going on after it was deemed safe for the adult population, and now we were continuing with phase 3 of testing it in certain populations, and immediately after we got an EUA for the 12 to 19, and now after full completion of phase 3, it's been submitted for review to FDA to get a full FDA approval. So we're hoping to see that very soon, and we're hoping to get those under the age of 12 also approved. So overall, there was no step skipped. It's very safe. And we've seen that through millions of administration worldwide. Next myth, please. Okay. So the third myth is the vaccines will give me COVID-19. And the reason that people have said, or this myth even came to like actualization is because of the similar symptoms people feel when getting the vaccine, such as tiredness, pain or swelling at injection site, fever, chills, headache. But the truth is, no, you cannot get COVID from getting the vaccine. The vaccine does not contain the virus. Only instructions on how to make the spike protein and cannot make you sick. Also, if you were to take a PCR test, it would be negative as long as you haven't gotten COVID in the past. And there are 3 antibody tests, and some do show false negative for the antibodies because it's the wrong test. I think only 2 out of the 3 can actually test for the appropriate antibodies for the COVID-19 vaccine. So the next piece is the COVID-19 vaccine will alter my DNA. And partially from Dr. Kampa's slides earlier on, that the COVID-19 vaccine will not alter, change, or interact with your DNA. The DNA is protected inside a nucleus, and the mRNA stays outside in the cytoplasm. The mRNA vaccine teaches your cells how to make a protein to help you build immunity. So for this piece, it's just important to know, kind of like in layman's terms, that if you look at that, the photo of the DNA within the nucleus and the RNA outside, that you know that it's the vaccine simply just gives instructions to create the antibodies, right? And the piece here is that if you believe in this myth, then you would believe that the COVID virus will do the same thing and will also attack your DNA, which even if you went with that belief, then which is worse, for the COVID-19 vaccine to do that, or the actual coronavirus to attack your DNA nucleus? But either way, both are false, and the COVID-19 vaccine will not alter, change, or interact with your DNA. Next slide, please. So this myth is the COVID-19 vaccine has fetal cells. So let me just tell you the truth before we talk about the background behind this. Fetal cells were not used for the development of any mRNA vaccine like the Pfizer or Moderna vaccines. So this stemmed from cell lines. What is an immortalized cell line? It's essentially a cell line that can be proliferated through like lab and different type of techniques. So it's not coming out of like a fetal, right? So historically, 50 years ago, there were 2 abortions that involved fetal research where they extracted these cell lines. But that was 50 years ago, and now these cells have been these cell lines are immortalized. So they've been used for a various amount of research. So this belief came from that, and but the reality is none of these were used for Pfizer or Moderna. And the fetal cells were never used for vaccine. So, and I think the reason why this is part of the slide is because Dr. Lopez's mom, who's a devout Catholic, talked about this and heard about this rumor, but even the Vatican says coronavirus vaccines are morally acceptable. So there you have it for this myth. Next slide, please. Okay, this is big because this is a myth that has been kind of going around and I think this is one of the hotter myths right now as we speak, and this is the COVID-19 vaccine will cause infertility or miscarriage. So the truth is the COVID-19 vaccine has not been linked to infertility. There are no reports of any impact on fertility from the information collected in the trials that were conducted. So this came from what sounds like I think it was a German doctor and epidemiologist who was also, it sounds like, a veterinarian. But one of the main concerns was there was a protein called syncytin-1, which shares similar genetic instructions with the part of the spike protein of the coronavirus. The same protein is an important component of the placenta in mammals. If the vaccine caused the body to make antibodies against this, they argued it might also cause kind of like an autoimmune reaction, so for the body to attack and reject the protein in the human placenta, making women infertile. However, I mean, first, before we get to what the truth is, again, you can use the same parallel justification. If you get the coronavirus, the same theory would happen, and you should have an autoimmune response, which of course didn't happen to anyone, and many pregnant people also got the coronavirus. So the truth is that the coronavirus spike protein syncytin shares small stretches of the same genetic code, but not enough to make an exact match. So an example they made to kind of bring this to life is everybody has at least a 10-digit phone number. It's like having the same one number in 2 phone numbers. That's how much they're similar. So there's a specific part of the proteins, but overall, this has been dispelled, and there are many pregnant women who's gotten the vaccine during pregnancy and even before pregnancy, and still were able to get pregnant. And many pregnant women have successfully delivered babies, and actually news articles have come out, as Dr. Kampa have alluded to, that now antibodies are safely passed to the newborn, which is great, especially since we all know we can't vaccinate anybody under the age of 12. Okay, next slide, please. So I think we can pause here. I mean, we've gone through, I think, just the basics on the COVID-19 vaccines, the side effects, what to expect, the numbers, the statistics, and we went through most of the myths. So are there any questions regarding this before we move on to kind of having a dialogue and conversation about COVID-19 vaccine?
Yeah, thank you so much, Dr. Kampa and Faye. I'll go ahead and read some of the questions out that have been in the chat, and then we'll open it up to a larger discussion. One of the first questions is, are vaccinated people protected against all strains and mutations of the coronavirus?
Yes, they are. So the data is showing that even against the various mutations and variants, including Delta, all COVID vaccines are providing protection against those as well.
Another question is, what are some of the issues that may not qualify a child to get vaccinated? And I'm not sure if that means when might children be eligible for vaccination, but like why for children?
So if they're eligible, like for instance, if 12 to 19, what would not qualify them from getting vaccinated? Is that the question?
I'm not clear, but I thought just, I actually was thinking probably more, when will the vaccines be approved for those under 12?
Oh, I see. I mean, some of that we don't know, but some of the rumors are that it should be coming around the start of the school year. So we're expecting it around maybe September, or October. But again, there's no clear timeline on that.
Yeah, I think the other takeaway to answer the other kind of deeper part of that question is that children are a vulnerable population. And so it's easy to get adults to volunteer and consent to be in studies, which is why the vaccine, came out first with adults 18 years and older, and then we got the younger adults and teens in. But it is really difficult to gather enough groups of people who are willing to have their children, be part of these studies, because you are, there potentially are risks, right? And that's why you give your consent to have your child do it. So that's why we always see a little bit of a slower rollout with any interventions that involve children.
Another question. There's a statement, a vaccine statement. The vaccine leads to memory loss.
The vaccine leads to memory loss. I haven't heard that before, but I don't think there's any data that shows that the vaccine leads to memory loss. Dr. Kampa, do you have any thoughts on that?
Yeah, no, that definitely would be a myth. I haven't seen any data showing that the memory issues or cognition is affected by the vaccine. COVID will. COVID definitely will. The infection will.
Yeah.
So
Yeah, and COVID has been known to affect people and give them strokes. So that will definitely affect mentation and cognition. But in terms of the vaccine, we haven't heard anything, and I don't think there's any data that even shows impact on cognition.
Well, that's really interesting, because it kind of leads into one of our other questions was any information on the studies that show COVID affects the central nervous system and the cardiovascular system, leading to memory loss, heart failure, and death. So that's really related to the COVID virus, not the vaccine.
It's related more to the virus. Yes, absolutely. And not the vaccine.
Yeah. The infection causes so much inflammation in your body that all of your systems start to work abnormally. And so people can start to form clots that when they shouldn't be forming clots, their vessels can become inflamed. They can start to shut down, which is what can cause heart attacks and strokes. And so, it's such a vicious virus, because so many of the body's systems can be affected if you do have severe symptoms.
Right. And just going back to one of the earlier slides, it shows that COVID, the virus, has a 20% chance of causing clots, which is 1 out of 5. So that's a pretty high percentage.
Magali, would you like to ask your question?
Oh, yeah. About the memory, I have heard actually of that. I've heard more of the second dose causing a bit of brain fog. Like you're trying to remember the name of something, you just can't. And it's like the simplest thing ever. I've actually heard of that, of some people, they got like a little bit of brain fog after getting the second vaccine.
I would say maybe it's associated with like the fatigue, the tiredness, and the flu-like symptoms that sometimes people feel. And it's more common amongst men than women, at least from the Pfizer study. But in terms of specifically directly linked to the cognition and mentality, I mean, there's no data related to that. Dr. Kampa, do you have any thoughts on that as well?
Yeah, same thing. And everything should be, kind of temporary, right? Yeah. And I do agree that it's probably more related to some people who get systemic symptoms, right? Where they feel that tiredness and fatigue, and but everything should resolve within a few days.
Is there any basis to believe that the vaccine itself would have a central nervous system impact or a memory, like on its own? I mean, does the technology even lead itself to that, the technology of the mRNA vaccine?
It shouldn't. The vaccine shouldn't be crossing, other than the antibodies that get formed by your immune system. None of the vaccines should be entering the blood-brain barrier in the central nervous system. So everything would be just kind of whatever systemic effects that you might be feeling from the vaccine side effects. Mm-hmm. But you do get protection, 100% throughout your body with the antibodies, but there shouldn't be any kind of direct central nervous system interaction with the vaccine.
Yeah, I think, and we've seen a bit of this in the chat too. I think I've heard anecdotally of a person who claimed brain fog after the vaccination, but it's not enough to say scientifically that's true. It might very well just be an anecdotal singular person here or there that had impacts. And I can imagine for a lot of us, stress, not sleeping well, that these times can also lead to, I think, less than stellar brain performance. So it's not. I think, from what I've read, it's not necessarily correlated, but it may be kind of coincidentally related.
Yeah, and you bring up a good point, is that, patients will bring up these issues, and it's really important to validate that what they're experiencing is real. And also to validate that we still don't have all the information, right? So, when somebody tells me that, I definitely will say, I understand that you feel that way. And, these vaccines can give people a lot of different symptoms. But the great thing is that you're protected, right? And these symptoms will go away in a few days. And so I think that's an important piece, so that patients don't kind of propagate some of those falsehoods into their network, and kind of make other people hesitant to get the vaccine as well.
Yeah. And quickly, I did just a quick search on the brain fog, and the first article that comes up is from a Stanford researcher talking about how brain fog is linked to COVID-19 patients, not the vaccine necessarily. But I mean, I can do more research on this to look more into the vaccine, but it is well linked to actually getting the COVID-19 virus, and it shows kind of like similar symptoms as Alzheimer's because due to the inflammation of the brains that happen, which is kind of in line with what we're thinking in terms of the symptoms of COVID-19 that is related to inflammation that may cause the brain fog, but not necessarily the vaccine. So maybe it's still due to the vaccine's symptoms, which is like tiredness, fatigue. And anytime we're all sick, I think we feel like we have brain fog sometimes, but we won't dispel this. We can look into this. And if there's any dispelling that we need to do, we'll definitely share that with this group.
Yeah, thank you. I think there's a lot of interest in that, so we'd love to hear more. We have another comment here about, people being hesitant for many reasons, and particularly focusing on those that have already had COVID and have been through potentially a traumatic experience with COVID, have long-term side effects, and now they're fearful of the vaccine continuing to impact their health. So there's kind of two questions, is like, does the vaccine present any health complications or serious health complications that people need to be worried about? And then number two, there's a comment that, why do I get the vaccine if it's not even going to protect me? People who are vaccinated also get COVID.
So I'll make a comment on the long-term COVID vaccine. So Dr. Sarah Lopez also, who created this slide, and going back to kind of the timeline of the study on the vaccines, the idea is if you don't develop anything in 6 to 8 weeks from getting the vaccine, the chances of developing any long-term symptoms or side effects from this vaccine is very unlikely. It's not like what she compares to as radiation exposure, right? Radiation exposure, especially on a daily basis, you get a little bit of radiation every day, and long term you can get cancer. This is not the case. You're getting these vaccines 1 or 2 times, and you're looking at the symptoms in the body. And even with Dr. Brad Spellberg, he's talked about historically there has been no long term effects for any vaccines created that has been created thus far up to date. So. That piece, and for the fear of the symptoms, there's also this notion of long COVID, and this is for those folks who, like you alluded to, have gotten the COVID virus and have experienced long-term effects, whether it's mild, moderate, or severe symptoms like loss of taste and smell, or just a prolonged cough. And some of these people, and you all may know some of these people, I know a few, who's never regained even after a year, and some have regained after a year, but some, we don't know if some may ever regain. actually, we can use this to our advantage when we're talking to patients, because those who know about long COVID, studies show, are more likely to get the vaccine, especially those who are like moderately hesitant, because they are fearful of getting those long-term effects. But so far, especially with the administrations like worldwide that we've experienced, there have been, and we're getting closer to a year. There have been, even looking at the actuality, there have been no long-term symptoms from the vaccine itself. Did you want to add to that, Dr. Kampa?
Yeah, Heather, you bring up a case that is really comes up frequently. Patients who've had the infection, they've had a traumatic experience, and now they question the vaccine. And early on, we were definitely seeing that repeat COVID infections, pre-vaccine era, right? Pre-December, were rare. But now, kind of a year out, we have seen that the chance of reinfection is actually more common. And so for people who've had, really severe COVID infections, or, know somebody who has, and kind of, carry that trauma, I think it's really important for them to consider the vaccine, because if you're still in this long-term recovery from COVID, whether it's your lungs still recovering, or we're talking about your brain, right, your cognition, and you get COVID again, we can't guarantee that the immunity that you got from your prior infection will protect you from getting the same level of severity or even more severe symptoms from COVID. And the only thing that will really provide you an additional layer of protection is the vaccine. And again, as we're talking about all these other ways, right, like the vaccine is one way to give us, 90% protection from an exposure, but social distancing, being aware about, wearing your mask, like all those in combination are really what's going to provide you the ultimate kind of highest level of protection from getting repeat infections if you've had it before.
And I think as a follow-on to that, so, and as I've read, Dr. Kampa and Faye, the COVID vaccine, although it does not 100% protect you from getting COVID, it does, in pretty much all cases, prevent the worst of the symptoms, prevent hospitalization, and greatly reduce the risk of severe symptoms and death. So the vaccine, it's a really powerful tool, but it's not an immunity blanket. It isn't that.
Yeah. And also, if you are up to date with nationwide news, especially for states outside of California who have an even lower unvaccination rate, there are many reinfection rates where they've experienced even worse symptoms a second go round because they are now infected with the Delta variant. And as you know from earlier discussions here in this call, that we just said that all the vaccines are known to be effective against Delta variants.
I do still have a few, we're really at the end of our time, but I do have a few more questions. Are people able to stay for maybe about 10 more minutes? Or do you guys have to go?
I could stay. And I think we can reschedule the second half of this talk.
Yeah, I was going to say.
Next week.
If there's another half, I think we'll have to postpone that to another time.
Yeah. Well, the good thing is we've gone through like most of the myths and just the basics of the vaccine, but we wanted to go over kind of like the talking points and motivational interviewing, but that's definitely
but let's keep talking about some of what we're hearing in the community. I'm happy to respond to those questions.
Fantastic. Thank you so much. Another question is, why does COVID impact taste and smell for so many, both during the height of the condition and then also lingeringly? Why is that an impact?
That's a great question, and it's the nature of the way that the virus works. And so it's a respiratory virus, so it's going to infect cells of your body's respiratory tract, which includes your nose, throat, and lungs. And what happens though in this particular virus, and it happens with other viruses too, but COVID-19 we've just seen it more frequently, and it's been more prominent and more pronounced. Is that the cells of your upper of your nose and your mouth, where they connect kind of in this area above the palate, are some cells that hold your olfactory bulb, which are the nerve endings that capture scent. and then also in your tongue, the nerve endings that capture taste. Those get irritated from the virus and they get kind of inflamed. And when that happens, they can't transmit the sensory signals that they normally do. And so they're not going to transmit anything that you're smelling. They're not going to transmit anything that you're tasting. So everything smells bland and tastes bland until your body recovers. Those cells heal a little bit and they can now start to function normally. So it happens with a lot of viruses, but with COVID-19, it just happens. This virus just happens to be more commonly seen. But as Faye mentioned, there's some people who have still yet to recover, and just again shows that some people have prolonged and drawn out episodes of COVID.
Another question, we have a couple questions or comments related to the experimental nature of the mRNA vaccine technology. And so the first statement is, the FDA has never approved mRNA. They only approved it now. Is it an experimental medication?
That's a great question. And I would say no, because a lot of these studies, you're right. So there hasn't been an approval process for an mRNA vaccine because, again, going back to this slide and seeing the timeline of how long it takes a vaccine to get approved is usually 15 years or longer. And again, that's because traditional vaccines, we were following this, more drawn out process of getting approval. And even then, the technology from before, as I mentioned, was old. We literally were getting dead viral particles, mixing them into a solution and injecting them into people. And it takes time and studies to figure out what that right combination of particles and solution is to protect people against whatever illness. Because the mRNA vaccine uses technology that leverages your body's own systems to produce immunity. It's an entire class of its own, and given the state of the emergency, it had to be moved forward in a way that was faster. But again, these were already being studied with SARS and MERS since 2003, and so we're not talking about vaccine technology that wasn't published or wasn't reviewed in journals and by scientists over the past year. This has been reviewed already, close to 20 years, and so it's a new technology on the market, but it's not a new technology in terms of the science behind it.
The next question is related to kind of I think we've heard that Gavin Newsom is talking about, and I know we've heard that President Biden is talking about possibly requiring the vaccine for certain workers. And wondering, the comment being, if this is an experimental technology, is that illegal to require people to have the vaccine? And that may be outside of your scope because that's a legal question, not a health question, but we'll raise it anyway.
So I can talk about what the mandate is now. And I think many of you are aware of the current mandate that was breaking news maybe 2 days ago. There is no mandate for the vaccine right now. The mandates are around showing proof of vaccination for all California state workers as well as healthcare workers. And if there is no proof of vaccination, they will have to get tested twice a week at the very least. So the operational piece of that has not been decided on yet for us and for DHS, but they are working on it, and I think there's a timeline for that. So right now, there may be talks, but currently it's not mandating vaccination. It's really about ensuring that people are COVID-free or COVID vaccinated. But what are your thoughts, Manuel, on the legality of that and potential?
Obviously we want everybody to voluntarily accept the vaccine and take it. And again, that's why we're talking with you all so that we can go into our communities and share this information. And vaccine mandates, you're right, it's a very slippery slope. And typically most institutions adopt mandatory policies once there's an official approval from the FDA, requiring a vaccine. So I think the reason why we're seeing kind of this movement toward doing so while they're still in EUA is because the virus has continued to spread and it's and it's worsening again when we thought we were in a state of kind of lower transmission. And so seeing the challenges that the state had with staffing hospitals and ICUs and emergency rooms with healthcare workers who were getting sick and spreading the virus kind of with or receiving the virus from patients, to maintain the infrastructure of our healthcare system. That's the reason why this first phase is really focused on healthcare workers. And then because Gavin Newsom has authority over state workers, is requiring the state. But that being said, again, as we mentioned, the FDA is the same body. It's the same people who approved the emergency use authorization. Should they see any information and data that looks off or looks dangerous or looks concerning to patients, they will immediately stop the vaccines. And we've seen that with the Johnson vaccine. So really, it's really only a matter of time before we get the official authorization. And that's because there's a lot of administrative pieces where the researchers have to submit data and papers and 1,000-page books of all their information. And so it just takes time to put that together. But more likely than not, the FDA, which gave the EUA, will more than likely give the official approval sometime in the next year or so.
A couple more questions. What are the most severe consequences you've heard of as a result of the vaccine? And has anyone died as a result of the vaccine? Like directly as a result of the vaccine?
Faye, do you want to answer kind of what we've seen locally?
So so there's this thing called a breakthrough with the vaccines, right? Like, so while most people are protected, there's like a 0.06% of people who still get COVID even after getting the vaccine. And this is seen more in the elderly population. So while there have been very few reported deaths from the COVID vaccine, it hasn't been linked directly to the vaccine itself. It's been linked to many comorbidities and other problems. However, it had to be reported when an example of this was a 75 years old who a month after he developed respiratory condition that caused him from the COVID virus that caused him to die. But cases of this are very, very rare. So there has been some linked, but not necessarily directly linked to the vaccine. But it has to be reported and has to be mentioned.
Next up, this was a personal question of mine. I've read that there's a diminishing effect of the vaccine as you're older, just as a situation of one's personal health, that it may not kind of take as much.
Yeah, I think that ties into the question previously, and that's why it's seen more in elderly, where the breakthroughs. I don't think the slide is on here, but there was a slide for this. But yes. It depends on, and that's why also on a second dose of Pfizer, some people are known to get a stronger response from it because everybody's kind of immunology is different and immune response to the vaccine and even to the COVID virus, as evidenced by people getting milder symptoms, and which is why sometimes it causes hesitancy when getting the virus because they say, I'm all right, I don't need the vaccine, right? And versus the elderly and just with their more vulnerable state and just more immunocompromised, that group tends to just have a different response to it, which is why breakthroughs are even more common. Dr. Kampa, do you want to add to that?
Yeah. I mean, bottom line is everybody's different, right? Yeah. And that's the reason why, and everybody's going to have varying degrees of immunity. When we say 90% protection, there's a range of that, right? Some people are going to be higher, some people are going to be lower. And that's the reason why herd immunity is so important, is that if we all have a high range of protection, we reduce the chance that the infection moves around and infects somebody who might have a lower immune response. So there is some truth to that.
Great. And then the next, we have a couple different questions and comments about third dose and, booster shot type of thing. I was reading the other day that there's some evidence that, that a recommendation is going to be forthcoming for a third dose for the Pfizer vaccine.
So I'm just going to echo what our infectious disease and CMO had said, Dr. Brad Spellberg, that, unless there are reasons associated with the different Delta variants that come up, because if we continue to have a big volume of people unvaccinated, chances of creating new variants are more likely, then the chances of needing a booster shot anytime soon is very unlikely. If there are recommendations, we can most certainly look into it and find out the justification. But if there are booster shots needed, the projection is that we won't be needing it for another 5 years from the point of getting the vaccine. However, again, this might change based on the conditions and the mutations of this virus. But at the moment, there is no strong recommendation for, and this is also coming from our DHS infectious disease expert, that there is no current recommendations for a third boost. Dr. Kampa, do you have any other comments on that?
Yeah, I think there's a lot of talk about this because we get a flu shot once a year, and the way that I think about the flu shot is because the flu shot literally changes once a year. Every year, it's literally, if you think of two dice and rolling the dice each year and seeing which two numbers are going to land, that's literally what the flu shot is every year, which is why we have to just get the new variant. And the flu vaccine manufacturers have all those mixtures ready for us. It's just depending on what we roll the dice on for the year. But the way that the COVID mutates, it's a much slower process, and the vaccine, the way the vaccine provides protection, it's not going to impact the way that the mutation changes, the way the mutation changes the virus. So because of that's why we've seen that even though there's been mutations like Delta, the vaccines still provide protection because they're giving you antibodies against proteins on the virus that haven't been part of the mutation.
So, hey, that's a question too. How does a virus mutate?
So a virus mutates when it's had the opportunity to infect a lot of cells and a lot of people. And what happens, and this is natural, like mutations happen in nature, right? Evolution has happened through various mutations and genetic material. But what we've seen, millions and millions of people get infected. What the virus does is, as it's replicating itself, and specifically the genetic material is very sensitive. And so little things can change and break here and there. And when they get replaced, it basically can form either a virus that works better or a virus that works worse. The virus that works worse is not going to infect more people, but the virus that works better is now going to outcompete the original virus, and it's going to start to infect more cells and infect more people. And that's how we saw, Delta is actually the fourth variant that was identified, right? We had Alpha, Beta, Epsilon, and then Delta. And then actually they're already down past Lambda, I believe. So there's already, dozens of mutations that have happened, but Delta seems to be, that fourth change that we identified seems to be the virus that just was a little bit more better at infecting people and a little bit more better at kind of replicating inside people's bodies and making them more sick.
And so it sounds like getting vaccinated not only protects, you from, greatly protects you from catching COVID, but it also that helps to diminish the number of opportunities for mutation. So that's another reason we want a lot of people vaccinated. I hope I've done justice to everyone's that. I copied and pasted and read them all through, but is there anything else? Is there a hand that wants to be raised to ask the final question of our fabulous panel, Dr. Kampa and Dr. Kristen? All right, then I guess with that, we will say Thank you so much for your time today, guys. Really appreciate your thoughtful answers to all of our questions. We'd love to, of course, schedule the second half of the presentation for next week, maybe. And we'll go ahead and I'll ask everyone on this call who has a question in advance. If you want to ask any questions this week, I can share those with Dr. Kampa and Faye, and that will help guide the discussion and conversation the next time we get together.
Yes. Okay, well, thank you all, and thank you for engagement and attention, and we look forward to engaging with you all again very soon.
Gracias a ustedes.
Muchas gracias. Thank you, everybody.
Thank you, everybody.
Thank you.
Yeah.
Bye.
Bye.